It has always been mentioned that lipedema is a disease which occurs primarily in women. But why only women? This particular reason, the etiology and pathophysiology of this particular condition is not fully understood. However, it has been seen that the feminine hormones, that is especially the estrogen, it appears to have an essential role in the lipedema symptoms. And whenever there is an alteration in the hormonal levels, especially of estrogen, progesterone, these particular symptoms get exacerbated, and the lipedema tends to start progressing and proliferates quite rapidly, especially during times of puberty, at the time of pregnancy, or menopause, or any stressful gynecological surgeries where ovaries are removed. So there's a problem with the hormone levels in the women, and that could be a triggering factor or a triggering point from where the lipedema starts to progress. It has also been seen that there are multiple genes that has been are responsible for the development of lipedema, and a lot of research is going on right now. And very soon we might be able to zero down on those genes which are causing this particular thing, so that we can diagnose more specifically, not only by clinical methods but also by lab methods. And then of course the research is going on not only for just diagnosing but also for the treatment, if gene therapy can play a role in reversing this particular condition. What happens when lipedema starts to progress? As lipedema starts to progress, the women start to experience heaviness in the lower limbs. Then they also can find new veins to start developing under the skin. And a lot of them are quite irregular in nature. So those are spider veins. Some of them can develop reticular veins and varicose veins, and the weight of the abnormal amount of fat that's deposited around the veins can cause pressure from the outside and cause kinking of the veins, resulting in stretching of the veins, causing looseness of the walls. The veins become incompetent, and there could be a backflow of the blood, resulting subsequently into varicose veins. Or sometimes because of the improper flow of the blood, they can form ulcers around the ankle, just above the ankle, and these are called venous ulcers, venous stasis ulcers, and those become quite difficult to treat subsequently. They become a chronic condition. There could be abnormal deposition of blood under surface of the skin, causing a blackish discoloration of the skin, because that occurs quite late, especially in those people who are having severe varicose veins. It has been also seen that these women who start putting on abnormal amounts of fat and the limbs are progressively increasing in size, they find it extremely difficult to do exercises. And when they can't do exercises properly, then they start becoming overweight, and subsequently it can go into obesity. Sometimes these women also can develop some kind of allergies because of breathing issues. As they put on weight and they become overweight and become obese, sometimes there could be a pressure on the diaphragm and breathing issues sometimes. And some of these ladies also then tend to develop hypothyroidism, migraine. They go into depression because they can't exercise, they're not losing weight, diet doesn't help. They start to develop eating disorders, and then all these things can have an impact on the GI system, and they can have GI disturbances and different kinds of allergies, and finally they may end up having type 2 diabetes and cardiac disease as well. So earlier the treatment is initiated, the diagnosis is identified, and treatment is initiated, the better for the patients. There are a lot of health related issues. Many of these women, they also can develop knee joint pains and ankle pains because of the differential deposition of fat. The alignment of center of gravity changes, and there's an enormous amount of pressure on the joints, and the joints get eroded at a particular area more than the other areas, and this can lead to arthritis and severe pain, and they end up with early knee replacements because the damage is quite severe and there will be no other option left. So this is another thing. Some of these ladies, of course, they have hypermobile joints and hyperflexible joints. So this can really go back and touch their hyperflexibility, hypermobility. So that is another reason why they could have joint issues, because lipedema is basically a connective tissue disorder. It is not just only the skin could be very lax, and you can stretch the skin, and these are all features of Ehlers-Danlos syndrome, and this could be a part of the particular condition.